Hey everyone, welcome to this week's episode of Hormonally Speaking. I'm happy that you're here with us as always. This week I have a guest on that I'm really happy to talk to because she is, in my opinion, kind of the epitome of what we're starting to look for in our healthcare system, right? Our traditional healthcare system is not doing so well by our actual health. And that's because some of the, old ways of doing things we're recognizing aren't really the best for sort of long-term health. In situations of acute care, allopathic medicine does great. In situations of chronic issues, and particularly women's issues, it's been a struggle. And so today's guest has actually moved over from that traditional allopathic path to a functional path. And her name is Dr. Tabatha Barber, and she has devoted her life to giving women a voice and a choice when it comes to their health and well-being. As a young girl, she struggled with self-esteem and identity issues, dealt with peer pressure, and survived the ridicule and stigma of becoming a teenage mother. As she shared in her first published book titled From White Trash to White Coat, The Birth of Catherine's Purpose, those events led Tabatha to finding her purpose in life. With perseverance and grace, she was able to redirect her path in life and become a successful physician. Dr. Tabatha Barber is a triple board certified in obstetrics and gynecology, menopause, and functional medicine. She has the unique situation of being licensed to practice medicine in over half the country, so you now have the ability to work with a functional physician virtually. She is the host of the Gutsy Gynecologist Show, where she shares her wisdom and knowledge with women everywhere to reclaim their health. She's also a keynote speaker, mentor, wife, mom, and grandma. By incorporating functional medicine into her women's health practice, she is able to provide women with the tools that they need in order to optimize their health and happiness, which in turn allows those women to pursue their purpose in life. Welcome.
Oh, thank you so much. I'm excited to be here.
Oh my goodness. That bio just incorporates so many things that have happened in your life, right?
Yeah. I definitely have not had a boring life. That's for sure.
No. Can we talk about how did you find yourself on the path of even wanting to become a doctor, after your experiences when you were a kid?
Yeah, I think this is a really important part of why I do what I do, because when I was a child, I was a free spirit. I didn't like authority. I didn't like rules. I didn't like school. I was going to grow up and be a rock star. I had no interest in anything academic. And when I got pregnant in 11th grade, I had to go on Medicaid and food stamps, and a doctor was assigned to me. I didn't have really any say. And so I got this really old, grumpy doctor who was on the verge of retirement, and he made it clear that he wanted nothing to do with me. And so a lot of things were done to me and not explained, and it was really a scary time in my life. And I really grew up during that time, and I had a traumatic delivery. I had a 4th-degree laceration from my vagina to my rectum, and he didn't repair me correctly. And so that was very traumatic. And needless to say, I had chronic pelvic issues after that.
Yeah, of course.
And so, here I am, a 17-year-old girl, and I'm covered in purple stretch marks, and my bottom is ripped apart and nothing's functioning well. And I'm trying to breastfeed a baby and watching all my friends go to prom and have graduation parties and plan their lives. And it was very traumatic. And I came out of that with a whole sense of purpose for my life. Like, I do not want women to go through what I went through. And I literally just had this epiphany, like, I need to become a doctor and help women have a voice and a choice so they don't, experience what I experienced. And so that led me down a really long, arduous path of, figuring out how to do well in school, got my GED, went to community college, got on the dean's list and transferred to Michigan State and got into medical school. Like, I was so focused that this is what had to happen. I just made it happen. And it's amazing, like when you believe in yourself and you actually want something, it's not that
You
difficult,
can
you
do it.
know,
Yeah,
you can
absolutely. Because you
totally
were
do it.
raising a baby the whole time that you
Yeah,
were
and
doing
I
that too.
actually got married to my boyfriend. So we were married for a while.
Wow.
Unfortunately, we grew up into different people. You know,
Yeah.
we were children when we got
Yep.
together.
100%.
But so I did all of that. I struggled. I got through. I did the surgical residency. I got the attending position. You know, fast forward 10 years, I was supposed to be so happy and fulfilled because I had, you know, created this dream and made it come to fruition. But here I was broken, and I was
Yeah.
stuck in a broken system. I was cranking out 40 patients a day,
Ugh.
delivering babies at night, doing surgery while I was super sleep deprived. I was living on donuts and coffee and Mountain Dew. And I was supposed to be happy, right? Like I would go to the grocery store and see all the babies I delivered and everything else. But literally, I felt like I was broken. And I got to a point where I was having major back issues and I could no longer walk away from the surgical table. Like I would
Mm.
finish a C-section and I would literally just have to hang and let my back relax because I couldn't physically walk away. I was so destroyed. And
Wow.
one night I couldn't complete a delivery. And so I had to do something, right? Like I
Yeah.
could no longer
Your
function.
body's like, we're done.
Yeah, my body had rebelled against the way I was living. And I went to the surgeon because that's what I was told to do. And he was
Mm.
like, oh, yeah, you have a herniated ruptured disc. You just need surgery. You need 6 weeks off. You're good to go. And like that blew me away. The thought of taking 6 weeks off, abandoning my patients, not doing what I was doing, because I was literally just go, go, go.
Yeah.
And that was one of the hardest decisions I ever did. And my partners and my office manager gave me no choice. They were like, you have to do
You
it.
have to
So
do this. Yeah.
yeah, you can't function. You
Yeah.
need to do this. So I took 6 weeks off. I healed. I came back, and of course I was on call for 5 nights straight because that's how it works in conventional medicine. You get punished every time you leave. You have to make up for it. And on my 3rd night, it was actually Christmas Eve, and I re-injured my back and I couldn't move.
Mm.
And
How long
there
was
I
this
was,
after the surgery?
6 weeks.
Oh my God. So right
And
when you got
yeah,
back.
so I had to call my partner and say, come rescue me. And so I went back to the surgeon and he said, oh, back surgery is like Lay's potato chips. You can't have just one. So we're just going to have to put some rods and screws in because you're most likely going to herniate above and below. And so let's just get you all squared away. And oh my God, it was like, time out.
Yeah.
Are you insane? Like,
Yeah.
I am not even 40 years old. What is happening right now?
Right.
And that was a huge wake up call. It was kind of like when I was 17, and just, it's a slap in the face. Like, you have to figure this out. And I did the unthinkable, and I took 4 months off of work and I went and healed myself. I found functional medicine. I found Mark Hyman, and I just started reading like a mad woman, and was doing physical therapy and any alternative thing that I could think of. I cleaned my diet up like crazy, and I felt like a new woman. It was absolutely incredible how different I was in that short time period. And, you know, once your eyes are open, you can't go back, right?
Yep.
So
Absolutely.
I try to go back to practicing medicine, cranking out patients all day long, being on this crazy call schedule. And I couldn't do it because I wanted to ask my patients about their diet and their stress level. And are you miserable in your marriage? Is that why you're coming and complaining of depression and anxiety and heavy periods? Like, I knew how I was practicing wasn't actually helping women. And so I really did a 180, and I lasted about, I don't know, 4 to 6 months trying to add functional medicine into my practice,
Mhm.
and it didn't work. You know, the managers were like, you need to do more surgeries, you need to see more patients, you need to make more money. This is
Mhm.
not going to work. And I left. I
Yeah.
just
You're
left.
like,
And
this is it. We can't make this work. Yeah.
yeah, and I was chief of staff of the hospital. I was chief of the
Wow.
department. Like, I was the top partner in my practice. I was running the show. And so that was another hard decision in my life,
I
but it's
bet.
been absolutely the most rewarding because I used to do 4 to 6 surgeries a week on women and not actually heal them. And now I don't do any surgery, and women actually get better
Right.
the way I
Right.
practice. So it's absolutely incredible. And I'm on a mission for women to know that there's another way. There's a way
Yes.
to actually fix the root cause of the issues of your hormone imbalances. And it's not a birth control pill, and it's not surgery.
Yeah, absolutely. And I was thinking about how you talked about how, to get through, you were eating the donuts and drinking the coffee, right? And just going to the anti-inflammatory diet that you ended up going to when you took the time off, right? Like how that brings down so much pain in our body, right? So much of
Yes.
the back pain and those kinds of things are coming from inflammatory foods, right? So
Yes.
it we talked about this before, but this sort of like surgical focused society, when there's, in some situations, absolutely surgery is necessary, but 90% of the time, there is all of this underlying stuff going on that we need to take care of. And those issues will go away because we're sort of not
Yes.
living in the ways that we're supposed to be living as humans and being healthy, essentially.
Yeah. I
Yeah.
never went back and had another surgery,
Yeah.
yet I'm healed,
Yep.
right?
Yep.
And I didn't have to go down the path of getting all that hardware put inside of me,
Yes.
multiple surgeries, because I got rid of the inflammation. I healed my body from within, because our bodies innately have amazing intelligence. They want to be balanced. They want to be in homeostasis. It's just that we continue to do things to prevent that or
Mm-hmm.
impede that. And
Mm-hmm.
so, I also want women to understand that, like, when I listen to your story, it hits home, this idea of gynecologists are surgeons.
Yeah.
I did a 4-year surgical residency.
Yeah.
I spent 4 years cutting out organs, removing disease, learning different techniques of hysterectomy, vaginal,
Mm.
open, laparoscopic, robotic, delivering babies, doing procedures in the office. I was not a hormone expert. I did
Mm-hmm.
not spend my time studying the intricacies of the endocrine system and how the adrenals and the thyroid and the blood sugar all affect your hormones. Like
Mm-hmm.
that, I got about as much as the family practice doctor, honestly.
Mm-hmm.
What I learned was, here is the birth control pill to override those
Yeah.
hormone systems. And this is what we use for most circumstances. And here are the synthetic hormones we use after menopause. I did not understand hormone imbalance. And I want women to realize, when they go to their gynecologist as the women's health expert, they don't understand hormones in the way that you need them to. And it's like,
Yes.
don't even be mad at them. They
Right.
don't,
They weren't
that's not
taught.
how they're trained. They
Right.
are surgeons. Yet we give them, we assume that they can handle all these hormone issues, and they
Yeah.
really can't. So,
Yeah.
I can't even be mad at my colleagues. I don't want to throw them under the bus. It's
Right.
just, they don't know. I didn't know. And I
Right.
feel terrible that I treated conditions the way I did for so long with the pill and the IUD and the surgeries. But that is how I was trained as a conventional gynecologist.
Right. Right. And I'm glad that you brought up that point of, utilizing synthetic and exogenous hormones, as the way of quote unquote regulating our hormones, when, most doctors don't even tell their patients, and I feel like some of them don't even really understand, they say that it will regulate your hormones, right? So
Yes.
most women believe when you take a birth control pill, that's taking your hormones and making them all okay, right? Rather than what it's actually doing is shutting down your own hormones and giving you these synthetic hormones in most cases. And so it's like, it blows women's minds when I tell them that. They're like, I've never heard that, like we think it's just going in and making everything okay. And it's like, there are repercussions for shutting down our own, hormones, the production of them. Like it's going to show up for most women at some point in their life.
Exactly. And, women are very much guinea pigs. Things aren't trialed, studied, or done. They're rolled out and given to us. So birth control pills came out, and I'm all for birth control. Like,
right.
I am not saying
100%.
I'm not. I would not have gone through medical school and college and not had a second baby without it, right? I couldn't have done all of this.
Right.
But I wouldn't have stayed on them as long as I did if I actually had been informed of the ramifications of their long-term use. So I just want women to have informed consent for what they're signing up for, because it does shut down your own hormone production. It completely stops the communication between the brain and the ovaries. And for a lot of women, 30 years later, we're seeing that communication doesn't come back online. And so women don't go back to having periods, or they can't get pregnant, and they're pissed off, rightly so, because nobody said, hey, if you take this for 10 or 20 years, you might struggle.
Yeah.
And now we're finding out that that's the case, because it was all just a big experiment. And so
And, one of the things that I learned just in the last couple of years was that it takes our hormones, right? Once you start having your period, once you start menstruating at whatever it is, ages 10 through 15, what have you, that it takes 7 to 10 years for those hormones to actually regulate, right? For so long, we're kind of producing the estrogen, and then finally we truly ovulate and the progesterone kicks in. So when girls get on birth control at age 15, 16, you're getting in there and changing things up before your own system has actually even regulated, right?
Exactly.
So it's
the
like,
system
how can that
never
not
got to mature, so you can't expect a girl to go on a birth control at 15 or a depot shot, which, good Lord,
the worst.
And then come off at 25 or 30 and be able to get pregnant. It's very sad that we're not acknowledging these truths, and that's not even the full ramifications. It also causes leaky gut and vitamin and mineral deficiencies, and it can be a contributor to turning on autoimmune conditions and all of these long-term chronic problems. And no one is talking about this in the conventional space. And I promise it's not going to get talked about, because it's such a political issue.
Yes.
I mean, we're at the point where they're trying to make birth control pills over the counter, like Tylenol. So this problem is only going to continue to multiply. And we need to get the word out there that, okay, if you want to use this for birth control, here's what, the consequences are. And I want you to be aware of it. And so that's my spiel.
Well, and the reality is, there's not a lot of great options for birth control that we would call more easy, right? Because I think a lot of women, when they hear about, the fertility awareness method, they're like, I don't have time to do that. We're lucky because there are more, at least, instruments and things that you can use now to sort of help that. But, there definitely need to be more options, obviously, for women for birth control that are not hormonal. Also for men taking over some of the birth control, or much more of the birth control than they have in the past. But the reality is, so many women don't go on the pill because of not wanting to get pregnant necessarily. They're going on the pill because their hormones are driving them crazy. They feel like they can't make it through their day, or there's just a huge struggle. And that's what their doctor says, okay, this is how we're
Yes.
going to regulate the system. Right. And so,
Exactly. That's the huge problem, is using birth control pills for acne and for mood
mhm,
issues and for irregular periods, heavy periods, PMS. Like, all of those are just symptoms. They're
yeah,
messages from your body
yep,
that something is out of balance, and you need to address that, and your
yep,
hormones will resolve. Like, I always tell women, hormone imbalances are the result, not the cause of your issues. They are just as affected as the rest of you. So you have to figure out, why are your hormones imbalanced? You need to start asking why, instead of accepting the birth control pill as the answer.
mhm,
And it almost always comes back to your diet and lifestyle.
yep,
How is your gut health? What are you eating? How are you managing your stress? Are you, you know, burdening your liver with alcohol and medications and all these exogenous chemicals and different toxins and things like that? And when you teach teenage girls how to think about that
mhm,
stuff and clean up their diet and lifestyle, they don't need birth control pills.
right,
I do it all the time, and it's amazing how surprised the moms are. I mean, I
mhm,
guess I'm not surprised, because that's how we were ingrained in this society. Like, that the birth control pill's the answer, that's the go-to, that's just what you do. You
yep,
start having periods, they're a nuisance, they're uncomfortable, you
yeah,
just get on the pill. Like,
yep,
we're really taught to ignore our health as women and our
yep,
cycles, and that it's just a burden and we need to ignore it. And so I would encourage us to, like, embrace the idea of getting in tune with our bodies and listening to those messages, because we have so much control over them, and that can be really empowering. Like, oh,
so
I
empowering.
actually need to rest for this next week because I ovulated and my body wants to chill,
Yeah,
as opposed to, like, you need to push through, you need to
right,
fight harder, right?
yep,
Or just the crazy messages that we teach our girls because we've been taught it. So
yep.
we need some disruption with all of this.
100%. I have a colleague who teaches girls and their families about their cycle, right? So she's, sort of that targeting that 10 to 13 age range. And I'm like, we need so many more of her, right? Because she really does take it and flip those messages on its head, right? Of when you move it into, I don't want to even want to say a different mindset, but when you have a different picture of it, right? It's a very cool, empowering thing. And interestingly, I don't know why, because it's not like I necessarily got it from my family, but I was actually really excited about my first period and felt really empowered in it. Although some situations happened with my mom that were ended up being disempowering. But, I think, what if we teach our girls, like, this is a really amazing thing. Our bodies are these cyclical beings, that we have all of these different powers at different times in our cycle. And if you understand, when and how and what supports you in those times, like, you're a powerhouse on a different level, right? Plus, in my opinion, that can help girls in, this very, like, sex pressured society, right? And especially with things like porn coming at, little kids seeing porn before they even,
Right.
like, learn about sex from their parents, and the repercussions of that in terms of girls hitting puberty, getting pressured, et cetera, et cetera. It's like, if you empower a girl to understand her body, then she has more of the ability to stand up and say, this is right for me, or this is not right for me, instead of
Yeah.
this whole, like, pick up the rug and sweep it all underneath there, And my colleague said that one of the things that she sees with the parents, and even in particular, the dads, is they start off so uncomfortable in the situation, but then as they learn, they become more comfortable with it. And it's like a thing that they can talk about as a family. So it doesn't feel shameful. It doesn't, and it's like, I think she teaches about, like, literally having a calendar on the fridge. And so you kind of know, I mean, obviously you're not super regulated when you're that young, but, sort of know what's happening or what's coming when, and how that helps the family work together better too, So I'm like, well,
Yeah.
what a, like, right?
I
So
love
different
that so
than,
much.
yeah, than how
Yes.
we do things. So
Oh
yeah.
my gosh. I think that would change everything right
Yeah.
there.
Yep, absolutely. And I mean, like you said, I think about like I got on birth control probably when I was 18, I think right when I went to college. And I had like horrible acne as a teenager. I definitely had yeast infections looking back. Horrible cramps. But also my mom had had horrible cramps. So it was like, oh, this is just a genetic thing. But it's like, oh, if I knew then what I know now, right? And it's like, yeah, my diet was full of sugar, as many kids, teens diets are, right? And full of like fast food and everything. And it's like, that if all of that could have just even been a little bit different,
Yes.
what my teenage years could have been like.
Exactly. I think if we can teach them that what they're putting in their bodies actually affects them physically and can have an effect on their periods, I just find it to be really empowering, especially when girls get into high school and they have more control over what they're eating and they
Yeah.
get to choose like their breakfast and their lunch a lot of the time. I just think I see them making better choices when they know that it affects their skin and their
Yep.
mood and their energy and their weight. Like that stuff matters to them and they
Yeah.
want to be their best,
Yep.
but we're not giving them the right tools. I have kids who are in elementary and middle school. And so I hear the curriculum that they're taught, and they're
Mhm.
still being taught like eat a ton of grains and processed GMO'd crap, and you can have sugar in moderation. And like, it's sad what they're hearing from society. And so as parents, you have to be involved and help them see how it works and give them a good example. Like
Yeah.
I make sure that I talk about how food makes me feel,
Mhm.
because food obviously makes my son feel a certain way, and I wanted him to make that connection, but he didn't want to just drill it into his head because
Right.
that's not how kids hear, right? So you
Right.
have to get them to be like, "Oh, I think I don't feel so great from that ice
This
cream
thing.
cone or
Mhm.
whatever."
Mhm. Absolutely. Yeah. I can imagine it's a tough balance sometimes, right? Because it's like you don't want to, yeah, come in with a dagger and be like, you have to eat this way, because that's not going to work. But having them start to make the connections, particularly as teenagers, absolutely, and that's definitely just not a message that we're getting in the mainstream at all, and
No.
our food systems obviously are generally getting worse too, unfortunately. So it's like you have to work even harder to eat well, in terms of like
Right.
just making those good choices. So once you decided to go the functional route, so what happened? Like, how did you open up your own practice? Did what, tell us the story of what happened.
Yeah, so I just decided that I was going to completely give up obstetrics. I was no longer going to deliver babies or do surgery, and I was just going to do functional medicine for women. I started out at a wellness center. That didn't work out, and I quickly had to pivot and create an online practice because unfortunately they went bankrupt and they didn't tell me until the doors
Oh.
closed one day. And I had a full
Oh.
schedule of patients for months and months. And so I said, what can I do? And I
Yeah.
literally created an online practice in 1 week, and I
Wow.
shifted everybody over, and I
Yeah.
just started seeing them from my house.
Yeah.
I'm sitting here in my house right now,
Mm-hmm.
and it's been wildly successful. Here I am. It's
Mm-hmm.
just over a year now, and it's like I'm nonstop. I'm so busy. And
It's
I
awesome.
originally got licensed in multiple states because I was going to oversee nurse practitioners
Mm-hmm.
that were in different states. And when everything shifted and it was just me and word got out, women just started showing up from everywhere. And it's like, I'm so grateful to be able to do this, but it's also really heartbreaking that women
Mm.
everywhere feel dismissed and unheard and not treated fairly.
Yeah.
I'm hearing it everywhere. As far as Australia, women are just like,
Wow.
my doctor doesn't believe that there's hormone imbalances. They tell me that it can't be tested. They don't think I need to, be on hormones. Like, we just get all these dismissive statements, and women are fed up. They're sick of it. And, so I'm right now currently trying to figure out, like, how do I clone myself? How do I help?
Right. We
all
need
of
more of
these
you.
women? Because women are waking up and they're ready to take back control. And, there's only one of me, and there's millions of women who are disgruntled and frustrated.
Right.
So that is my new mission, like, figure all of this out, because this conventional system is broken and it's failing women
miserably. Yeah. So you're licensed in multiple states now, and so you can see women from a bunch of different states.
Yeah, I think it's currently 28 states or something like that. Yeah.
That's really cool. Yeah, I know. I'm sure that's a lot. But yeah, it's like, so do you create a functional gynecology school to teach like nurse practitioners, or, I'm sure that there's kind of lots of ideas and thoughts in your mind around all of it.
Yeah. I mean, every single day I'm getting women from all over the place who are they're in the same boat, especially when it comes to thyroid issues. They're being mismanaged. And I see a ton of women not being diagnosed with an autoimmune component of that, and they're just being given Synthroid, and Synthroid downregulates their thyroid, and their reverse T3 is like 25, and so they're coming to me and they feel like crap and they don't know why, and their doctor's telling them it's all in their head. And every day I'm seeing something. Or people come to me and say, well, I've been told that I don't have an adrenal issue. And it's because conventional medicine only looks at disease. Like, I would love for women to get this point. Medicine is very much a disease diagnose focused state. So we are not taught how to actually create health and wellness. We are taught how to search for a diagnosis that matches up with a medication or a surgery that has an insurance ICD-10 code to go with it, to complete our charting, to get paid, to make our employers and hospital systems happy. And we learn how to manage that disease, with the fact that hopefully slow it down, but there's never any thoughts or beliefs that we can stop these processes or reverse them or actually create wellness. Like, that is not taught in conventional medicine at all. And so if you don't have complete adrenal failure where your adrenals aren't functioning, or a tumor that's causing levels in the thousands, you don't have an adrenal problem, because there's not an ICD-10 code for that, for a medication to treat your adrenal dysfunction. So when you're dismissed by your doctor and told that your adrenals are fine, it's because you don't have one of those extreme diagnoses. I try to explain to women, it's the same thing with diabetes. You'll get your complete blood chemistry once a year. Those are like your good markers for making sure you're healthy, a CBC and a CMP. You come back, your glucose says it's like 105 or something, and they're like, oh, you're fine, we'll see you next year. If you're lucky, you might get a hemoglobin A1C, like if you pay out of pocket, say it's 5.6. You're good, we'll see you next year. Next year it's 5.7. Oh, your blood sugar's up a little bit. You need to change your diet. We'll see you next year. This continues on until you're told you have diabetes. And lo and behold, the patient's like, you told me I was fine and healthy last year. What do you mean I have diabetes? So it just happened this past year? No, they don't follow trends in conventional medicine. We do not look at the pathway that you're going down on your health and illness journey. We wait until you get to the destination to make this declaration of, yep, you have diabetes. Yep, you have heart disease. And so it's not doing women any favors to go to these exams every year and get this blood work and give them this false idea that they're healthy when they're really on the wrong paths and they're not being, guided properly. So I just want women to understand that. And again, it's because medicine is a disease-focused entity. And so if you want to actually be healthy and well, you need to find a functional doctor, an integrative doctor, an anti-aging doctor, someone who understands health and wellness, and go that route, because whatever you focus on is what you're going to get, right? If you focus on disease, you're going to get disease.
Right. That was so beautifully put, and such an important thing for women to understand, right? I try and explain to my clients all the time, the reference ranges on those labs are massive to begin with, right? And it's
right, because we're trying to rule out tumors,
right,
or tell you you're not going to die tomorrow,
right. It's like pathology, essentially.
Yes.
Yeah.
Like the estrogen levels go from 30 to 300, quote unquote, normal.
Right.
It's
crazy.
like you can wear a sock size 6 to 9, but you can't wear shoes 6 to 9. I am an 8. If I wear a 6, I can't wear that shoe. It will be miserable. And if I wear a 9, it will fall off my foot. Like literally those ranges mean nothing at all.
Absolutely. And it's fascinating too, because all of clients come to me with some of their labs, and even then there'll be things out of the reference range and the doctor's still like, it's fine.
Yeah, because they don't have the diagnosable disease. I see that all the time with liver enzymes. Liver enzymes will be, in the hundreds or couple hundreds. And what we say is, you probably have fatty liver developing. Don't worry about it. So you're on the path to cirrhosis and liver failure. But we don't intervene because there is no medicine at that point. There is no surgery needed.
Right.
And we don't know how to reverse fatty liver as a conventional medical system.
Right.
We do in functional medicine, like get rid of your processed foods and carbohydrates.
Exactly.
We understand that. But in conventional medicine, that's just not taught. There. And so I tell women, it's not even worth being frustrated. Just go seek alternative help. Find a provider who understands health.
Absolutely. It reminds me of the story of one of my clients, because of course I can't diagnose since I'm, an unlicensed practitioner, but ran some labs, and her thyroid antibodies were, I can't remember which one, but it was 600, right? Which is a little scary.
Yes.
But her thyroid was still fine. Like it was actually may have been a little bit out of functional range. Maybe her TSH was a little bit, but her free T4 and free T3 were looking good, So I said, there may be some autoimmune component happening here. You should talk to your doctor, right? And her doctor took a look at that, and the 600 thyroid antibodies, they were like, your thyroid looks fine. We don't worry about these antibody numbers. And I'm like, are you kidding me? Because as you said, like until her thyroid is essentially busted via what shows up on the thyroid labs, they can't do anything. And all they'll do at that point is put her on Synthroid, right? That's pretty much the process.
Or even worse, on biologics to suppress the immune system. So autoimmune is grossly mishandled in conventional medicine. It breaks my heart how we just have this complete lack of understanding of the autoimmune process and what the triggers are and the drivers of this confused, overactive immune system. So it's not that your immune system hates you and it wants to take out your thyroid. It's confused and it's responding to something that it keeps seeing, and you're not removing that trigger. And so conventional medicine will say, well, then let's just suppress the immune response so that it stops happening. The problem is you suppress the entire immune system, and then you can become very sick. You're at risk for developing cancers. I mean, these biologic medications are very scary to me. Like that's the last thing I would ever put in my body. Yet they prescribe it like it's candy, like it's no big deal. Like, you just need to go on a biologic. And the ramifications of that are huge. And, so often we don't even understand in conventional medicine that estrogen is immunoprotective. Like we know, like, let me just explain. I learned this in medical school. Like I learned that when you get pregnant, your estradiol gets suppressed because you
That's all right. The animals always make their way in at some point.
apparently there's some wild animal outside. Calm down. Calm down.
Like, Mom, something's going on. Come on.
So we know when women get pregnant, half of the fetus has foreign DNA. It's from the man. It's DNA that would be destroyed by your own immune system if it saw it in the body. So what happens is our body turns down estradiol, which turns down our immune system so that we don't reject that fetus. We keep it there and keep it alive. And the same thing happens when we go into menopause and that estradiol level goes down. Our immune system shifts and we don't have that protective immune response anymore. We get this major downregulation, and you see autoimmune conditions pop up at menopause all of the time. Yet we don't put 2 and 2 together in conventional medicine and say, oh yeah, I think the hormones are related. Same thing with cardiovascular disease and diabetes. As soon as your estradiol level is consistently at menopausal levels, you become insulin resistant. Your arteries in your cardiovascular system harden. They lose their elasticity. So your blood pressure goes up. It shifts how things are processed in the liver, and your cholesterol goes up because you're no longer using all that cholesterol to transport your hormones. Like all of these things are affected, and nobody says, that might be related to her hormones, like it's so frustrating. So all I can do is like just educate women, because the system is so broken. It's like a lost cause. I remember being a broken physician. I didn't have time to read new studies and look outside of my 2 mandatory journals that I had to get through each month. Like I was freaking exhausted. I didn't watch daytime TV or do any of these things. So I never knew about health and wellness. I never knew about Dr. Mark Hyman and functional medicine. Like literally those words were foreign to me until I went on that healing journey, because I was never exposed to it. I was stuck in my broken system, seeing patients 24/7, just trying to survive. And so I want women to understand, like, they're not going to get what they need in that broken system, and and don't even be mad at the doctors. They're just as broken as you are.
Yeah. And most of them are, struggling and not really wanting to be a part of that system. I don't want to say most of them, but a lot, it seems like more and more are just tired of being part of that system. Because I mean, what kind of life do you have, when you're a doctor working that many hours and don't have time for anything else? It just makes no sense. Let's piggyback off of that, because I do want to talk a little bit about hormone replacement therapy and, sort of your thoughts on that. And particularly a lot of women that listen to this podcast are in perimenopause, right? And there's kind of this debate of when should I, et cetera, et cetera. So take us down that path.
Yeah. So when I went to medical school a long time ago, it was like over 20 years ago, what I learned was already antiquated. It's like what we learned in the 50s and the 60s, not much changes when you go to medical school. I learned that you start puberty, you have periods, you get pregnant, you have more periods, you have this perimenopausal transition of about 1 or 2 years while your periods start to grow further apart, or you skip a few, they lighten up, and then you go into menopause and stop having periods. Like literally, that's what I learned. And then you can use hormones if necessary. But then I came out into residency and the Women's Health Initiative came out, their preliminary results, and scared the entire world, and everybody got taken off their hormones overnight. So it was a really interesting time for me to be training and coming out. And everybody was scared of hormones, and we thought hormones kill, hormones are bad. And so that is the myth that's been perpetuated now for 20 years, because this was 20 years ago. And so women are definitely scared of their own hormones, which is super sad. And here's the problem. That study had so many issues. That study, first and foremost, was on synthetic conjugated equine estrogen from horse urine. And it had a synthetic progestin in it, not at all bioidentical. Bioidentical, all that means is it's the same chemical molecule that your body makes. And so it fits into the receptors and sends the same signals. And so the synthetics, they go into the receptors, but they don't bind in the exact same way, and they send a little bit different signals. And so synthetic progestins actually do send the signal to the uterus to stop growing the lining of the uterus, so you don't get uterine cancer or fibroids, things like that. But it goes to the receptors in our brain and our cardiovascular system and the rest of our body and sends a warped signal. And that's why women feel depressed on progestins, and they gain weight, and they feel not like themselves, because it's not sending the exact same signal. It's a different molecule. So here we are, we studied these synthetic hormones. The average age woman in that study was 64. So she was already 10 years postmenopausal. She had been without hormones for 10 years. And then they gave her these synthetic hormones. The majority of them were smokers, which we just don't do that, right? Like, we know that you have a risk of blood clot and stroke with smoking. And the majority of them already had comorbidities like diabetes or cardiovascular disease setting in. And so that what we've learned is that's not the appropriate population to give hormones, especially synthetic hormones. So we did learn things. That's what we learned. We learned that you want to start hormones during the menopausal transition, where hormones are starting to decline, not 10 years or more afterward. And you want to use the bioidentical chemical that your body makes, not something that isn't the same, because it sends different signals. And so now we understand how to do this safely, as opposed to what they did in this Women's Health Initiative 20, 30 years ago. So we have learned a lot, but in the meantime, women had to suffer for the past 20 years. And now we have to undo all of the myths and the lies that estrogen kills and all of these crazy things. Like, literally in that study, the estrogen plus progestin arm is what had an increased risk of breast cancer. It was the synthetic progestin. Yeah, we don't talk about that. It was the estrogen that causes, risk of blood clot and stroke. So what we now understand is, if you can, don't take oral estrogen. Get it through your skin to bypass that liver, so you don't have that risk of blood clot and stroke, even with the bioidentical estrogen, because when bioidentical estradiol goes into your gut, it actually gets metabolized by bacteria in your gut into estrone before it even goes into your bloodstream to get used. So you're already converting it into a form you don't like before you even use it. So I don't like oral estradiol. I like patches, creams, pills, pellets, not anything that has to go through the gut. Progesterone is the opposite. Progesterone is great as a capsule because it actually gets metabolized into a form that hits your GABA receptors in your brain and helps you sleep and helps you have less anxiety. It's like your body's natural anti-anxiety hormone. So progesterone is not only needed to protect the uterus from unopposed estrogen, but it's needed to protect your entire body from unopposed estrogen. So we are still failing women in conventional medicine in this regard. If you have a hysterectomy, we will give you estrogen for your hot flashes and, menopausal symptoms, but we don't give progesterone because we don't think we need to protect you because your uterus is gone.
Right.
And that is antiquated, outdated garbage. Like if you are on estrogen, you need to be balanced with progesterone. I don't care what your age or whether or not you have a uterus. That is besides the point.
Right.
So progesterone keeps us balanced. It keeps us feeling amazing. The other piece of it, testosterone also declines from menopause. Once our ovaries are no longer making hormones, our adrenal glands take over. And so our adrenal glands start making more estrogen and testosterone from DHEA. And what we have seen over the past 30 or plus years is that women are so busy and successful and doing all these amazing things, running companies and being entrepreneurs and having families, doing it all, having it all, being it all, that by the time they get into their 40s, their adrenals are already shot. So once their ovaries start failing, they don't have that backup reserve of their adrenals for their sex hormones. So we're seeing these perimenopausal symptoms 10 or 15 years before menopause. And what it is adrenal dysfunction and adrenal, they're giving out on us. We don't have any reserves. We don't have any backup ability to make sex hormones once our ovaries fail. I'm seeing more and more women going into premature menopause because they're training for triathlons. They're the CEO of some huge company. They're,
all at the same time.
Right. All at the same time. And it's like, oh my gosh, we can have it all, do it all and be it all, but maybe not at the same time.
Yeah, not all at once.
At the, expense of our ovaries and our sex hormones. So that all needs to be taken into consideration because our great grandmothers did not have this chronic everyday stress that we have. They were not up recording podcasts at 9 a.m. and seeing patients all day. And I coach lacrosse and we go to tournaments. And I mean, we're constantly doing stuff as women and we're trying to work out and look good and have fun with our girlfriends and do all the things. And that is really taxing on our body. So I encourage women, if you're at the prime of your life, when your ovaries stop working, you can safely go on bioidenticals. There is a safe, beautiful way to do it. And, there's this huge argument that menopause is natural and we should just allow that process to happen and you shouldn't be pushing bioidenticals. And I don't push anything on anybody. I give them all the options. But here's the reality. The year 1900, our lifespan was 49. Right now it's 82. So we're living half of our life in a menopausal state without hormones. That feels like crap. And if we are just at the prime when this happens, I've seen women lose their jobs, lose their careers. I've seen way too many relationships and marriages go in the shitter because women no longer feel like themselves without their hormones. They lose everything. And so if
why do we have to suffer?
Man, there would be no question. Right? And going on hormones. Duh.
It's like Viagra is pushed for men in their 70s, but women have to feel like crap for 40 years.
Exactly. So I'm not ready to sit on the porch and knit. I might be a grandma, but I am very busy and I have stuff to do. And unfortunately, you need hormones to do that. And so I encourage women to find a practitioner who understands the intricacies of hormone balance. Because the other piece I see all the time is women will get on bioidentical hormones, but they won't take care of their adrenals and their thyroid and their stress and their diet. And so we're constantly dose chasing and adjusting things because you're not actually fixing the problem. You're not metabolizing your hormones properly. Your adrenals are still struggling and stealing your progesterone. It doesn't matter if you're making it or taking it. So you have to do all the work
Yeah.
regardless of whether or not you take bioidenticals.
Absolutely. It's such an important point because, again, a lot of times, yeah, I get it. Sometimes when women are just like struggling, it's like, give me the hormones. And it's like, absolutely. And you need to make these other changes too. I know we're coming to an end, but I have two quick questions I wanted to ask you. In terms of, as you mentioned, in the study, women were over 60 when they put them on hormones. We know that it's much better to go on hormones as you're hitting sort of the menopausal transition. But what do you think about women, say, that have been in menopause for 10 years and they do have indications of osteoporosis and maybe some heart disease and that kind of thing? Do you think it's okay for them to go on bioidenticals at that point if their, hormones are flatlined?
I think it's worth having that discussion with your provider that everybody's an individual. So we all have different risk factors.
Right.
I want to know, like, how overweight are you? Do you smoke? Do you move your body? Do you drink? How much alcohol do you drink? What does your diet look like? And if you're willing to clean all of that stuff up and take the risk of possibly having a blood clot or a stroke, that type of thing, then yeah, let's do that. And some women only need topical
just a
therapy
tiny
at that
bit.
point, just enough, especially vaginal health, like that gets really bad, after about age 60. A lot of women will tolerate it through their 50s. It's uncomfortable, it's dry, my bladder's irritated, these things, and they just they suffer through, and then they hit about 60 and it's like, I'm peeing my pants, I'm miserable, I gave up sex completely because it's horrible down there. And that's when they realize, like, man, I should have went on some hormones, and so it's not necessarily the safest to start systemic hormones at that point, but I do have women that do sometimes, if they're overall healthy otherwise. But there's still that stigma of like, oh my gosh, I'm going to get breast cancer. Like that's literally what's just ingrained in our brain. And I will tell you, alcohol is the biggest risk factor for breast cancer, not estrogen, it's alcohol. So if you want to save your breasts, stop drinking so much.
There it is.
And you will actually metabolize your estrogen properly because you're not metabolizing all that alcohol. So because we've been fed a line of bull crap and we need to undo all that.
It continues to be out there. Thank you so much for answering that question. I think that was such important points you included. So one kind of really specific question, and then we'll wrap it up. What do you think in terms of, a lot of women will go to maybe an over-the-counter bioidentical progesterone, right? Because that's something that they can get without a prescription. And so, whether it's good or bad, whatever, obviously I recommend always work with a practitioner too, because you want to be able to test, you want to be able to track your symptoms and everything, but some women are doing it out there. And so, I just kind of want to speak to that. In terms of testing, is there a good way to test the hormones when you're using the topical progesterone? Because I know there's a lot of debate out there.
Yes. So I will tell you, as a gynecologist, I started with the topical progesterone because taking bioidentical progesterone was never anything I was taught. I wasn't taught to prescribe it or use it. And so I started with the oil, and lo and behold, I started sleeping better and feeling better. And I finally went on prescription. And for some women, the topical is enough to help with the symptoms and really calm things down. So I have women who will do topical and stay on that because the prescriptions are higher doses. You could double up on your cream. If you're taking 40 milligrams, double dose is 80. That's pretty close to what a lot of menopausal women take, is 80 to 100. So it does work really well for a lot of women. If you're on estrogen and you have a uterus, you probably need a higher dose for that uterine protection. But otherwise, the creams and oils are fine. But like you mentioned, you can't really measure those levels in blood work or even saliva or urine. The topicals just don't metabolize into a form that can be measured. And so it is completely based on symptom relief. How do you feel? Do you feel better? And I will tell you, that's how conventional gynecologists practice. So they should not be poo-pooing that, because
right.
That's how I was trained to prescribe estrogen, is you start at the lowest dose and you increase it until their symptoms have subsided. We weren't trained to measure levels or to follow levels, any of that. It's all based on symptom control. You read all of the ACOG bulletins, the NAM Society, like the Menopause Society, American College of OBGYNs, it's all based on symptom control. So it's completely reasonable. But I would argue, you know, now that I've gone through functional medicine training and A4M training, all of that stuff, the safest way to do it is to see how you're metabolizing with a urine test, to see those metabolites of your estrogens, see what your levels are periodically, to make sure that the dosing is in the correct range, because it depends on if you want just symptom control or if you want the anti-aging, disease slowing process benefits of it. So there's a couple different levels. And then there are some who advocate levels of continuing women to cycle after menopause, reproductive age levels. That I don't necessarily agree with. I haven't seen the research for that benefit. You can get the benefit without going all the way up to having a cycle again. And who wants to have a
I know. They're like, that's not the part I want. They're like, I want to feel better. I don't want to bleed again. Yeah, exactly. Yeah. Thank you so much. That was super helpful. So this was an amazing, amazing interview. You covered so many important points for my listeners. And I'm so, you know, I mean, I feel like I try and drill these things in my listener's head, but like, it's always good to hear from a doctor who really understands this from so many levels to be saying these things, so that, you know, it just gives women a lot of freedom around some choices now, and understanding that impact of diet and lifestyle, always coming back to that, you know. So
exactly. Well, thanks for having me.
Absolutely. Okay, you guys, thanks for being here, and I will see you next time.